Hello, so this is a room where we're going to be having our assessment. All right, as you can see, that's a bed over there, and that's my wife Yakima, who's playing the role of the 17-year-old male patient. All right, and then here is my Seneca ID card. It's Jonathan Shamatutu, Jonathan, Shamatutu, Shamatutu. All right, so we're going to begin the assessment, but I'll just have to turn the camera first. Oh, there we go. All right, so at this point, introductions have been done, and hand hygiene has been performed. Vital signs have been taken. So vital signs are 115/70, which is normal. They're 115 for the heart rate, which is tachycardic. Respiratory rate is 22, which is tachypnic, and 39.7 is the temperature, which is a sign of a fever. Okay, so the next thing I'm going to do is ask the patient questions about the neuroscience and stuff. So when was the last time? Sorry, have you had a headache?
Yes.
Okay. What about dizziness?
Dizziness, yes.
Okay. So that's yes to dizziness. What about weakness?
Weakness, no.
Seizures?
Seizures, no.
Okay. Tremors?
Tremors, no.
Okay, no to tremors.
No.
Have you had any difficulty with speaking or swallowing?
No.
Any head injury?
Head injury, no.
Okay. What about shortness of breath?
No.
Okay. What about any cough?
Yes.
Okay.
Yes.
Um,
Cough, yes.
Any productive secretions with the cough, like any buildup of phlegm or anything like that?
No.
And the last question to ask you is difficulty with breathing. Do you have any pain whenever you breathe?
Pain, no. No pain.
Okay. All right. So then the next thing to ask you is more about your headaches. I'm going to ask the patient a few more questions about the headache. Okay. When did it begin?
My headache 1 day ago, and it got worse today.
Okay. That's unfortunate. What about what do you think brings it on? What makes it the pain? What makes it better? What makes it worse?
Movement and lights.
Okay. What about the pain? How would you describe it? Is it stabbing? Is it throbbing? Is it dull or aching?
It's definitely a throbbing pain, yes.
Okay.
And,
Yeah. Does the pain radiate or does it spread?
all over my head. It does not spread. I feel very tired and fatigued and dizzy.
Okay. How would you describe the pain from 0 to 10? 0 being no pain to 10 being the worst pain ever.
Definitely 8.
Okay. And when did the symptoms begin?
They began at 1 day ago, and now today it's worse.
Okay. And what about medications? Have you taken any medications?
Yes, I have insulin, and yes, I have insulin.
No, what I mean, like, have you taken any Tylenol?
Oh yes. Oh, I'm sorry.
Advil
yes,
I've
taken Advil, I've taken Tylenol, but nothing works. I'm still in a lot of pain. Yes.
Okay. And then the last question to ask you, about the pain. The headache pain is. Do you understand why this is happening? The headache pain?
No, I don't know what's causing this. I just know that I'm sick all the time. I feel sick all the time.
Yeah, that's unfortunate. So of course you want your headache to feel better.
Mm-hmm.
Okay. So the next thing I'm going to ask you are medications that you're currently taking. Just general medications.
Yes, here it is. I'm taking insulin. Yes.
Okay. Any allergies?
I'm allergies. Yes, I am allergic to penicillin. Oh, definitely. Yes.
Okay. So we'll keep a note of that on file in case you get admitted to the hospital. Okay. So the next thing I'm going to ask, do with the patient is a quick assessment, a further assessment in this case. Okay. So as far as the appearance is concerned, the patient would be, kind of clammy. There will be flushed skin as well. Behavior will be lethargic based on the presentation, uncomfortable, a little bit uncomfortable, fatigued as well. As far as breathing is concerned, they're tachypnic as far as the breathing, but they're not using any accessory muscles at this point. Okay, and then I'm going to ask you some questions about where you are. So where are you?
I'm at the doctor's office.
Yeah, so in a hospital, right?
Hospital. Yes,
Yeah,
I'm
yeah.
at the hospital.
Do you know what the date is?
The hospital room. I believe it is June 9th, Sunday, June 9th,
Okay.
2024. Yeah.
Okay. Yeah, there you go. And then you of course know you are. So the patient's
Yes, I'm
alert
in
and
the
oriented
hospital. Yes.
times 3. So they know where they are, they know what time it is, and they know who they are as well. You know, which is important. Okay, and as I said earlier, no accessory muscles are being used, no signs of a tremor as well. Next thing I'm going to do is a quick eye assessment for the patient. All right, so there you go. Okay, so the patient's pupils and eyes are round and reactive and accommodate to light as well. The patient also is able to follow commands, and the eyes are able to open spontaneously. And as you know, they are alert, yet a little bit fatigued. Next thing I'm going to do is hand strength. Okay, so you squeeze my hand. All right, and then your legs. So this leg first. Just press down. There we go. And then this one here. There you go. So that's good leg strength. All right. Okay, so then the next thing we're going to do is a quick assessment of your lungs. So we're doing a lung assessment of the patient. Okay, starting off with the front, the anterior. So the apices, you breathe in and out, in here. Okay, and then the upper lobes, here. The middle lobe of the right lung. Okay. The left lung only has 2 lobes, so lower lobe here. And over here. All right. And I'm going to do the back as well. Okay, so the apices from here. Okay, and here. Upper lobe. Okay, and here. Lower lobe. Okay, and here. All right. There we go. So that's it, the lung assessment done. So the sounds were normal vesicular sounds, but if there's any crackles, any fine or coarse crackles, that's a sign of an underlying condition. So something like pneumonia. So we know that the patient is clear at this point. Okay, so the next thing I'm going to do is call the doctor. I'm going to call Dr. Brown. Okay. Hello, Dr. Brown. This is Jonathan, calling from Emerge. So I have a 17-year-old male patient that is presenting with acute symptoms. The patient has a history of diabetes diagnosed at age 6. The patient reports that the diabetes is poorly controlled. They mentioned they've got a headache. It's 8 out of 10. They also have neck stiffness. They mentioned that they're dizzy. However, no shortness of breath. They deny any seizures. They deny any weakness. As far as the vitals are concerned, 115/70 was the blood pressure. 115 was their heart rate. Respiratory rate was 22, and they have a fever, so it's 39.7 is their temperature. Okay, so the patient, his lungs were clear, normal sounds, vesicular sounds, and the pupils and eyes were round and reactive to light, and they accommodated as well. The patient has been alert, but yet lethargic. So as far as recommendations are concerned, I was wondering if we can get the patient started on an IV, because the patient is presenting as dehydrated. They've got a headache, they're lethargic, they're weak as well. So I think IV would be good, and then they may have meningitis, but we're not too sure. So maybe we can get like a lumbar puncture started, doctor, if that's okay. I don't know what your recommendation is in that regard. And I've placed the patient in isolation, just to make sure that we rule some things out, some more things besides meningitis and things like that. So yeah, whenever you can you just come over, just to quickly assess the patient. All right, thank you, Dr. Brown. Okay, so now the patient's going to ask me some questions about the assessment and everything that's been going on.
What do you think is going on with this patient?
So the patient looks like they have meningitis because they're complaining about a headache, neck stiffness. The patient also has a fever, 39.7 as well. Mm-hmm. They have they're feeling kind of like dizzy as well. But no, there's no shortness of breath. So that can be a typical presentation with pneumonia. Yeah, so that's what's happening. So next
Okay.
question.
What are two nursing
Interventions.
sorry. I'm gonna try again. What are two other nursing interventions that may be required for this patient and why?
Okay, so with the patient, I would put the patient in isolation, just to rule out any other conditions that they might have, but also to avoid the risk of infection for other patients. I'd also put the patient in a comfortable position, just in case they're struggling with their breathing. If they're laying on the bed, the bed will be put at a 30-degree angle to help them with their breathing. And, of course, when start the IV, get the IV started, as the doctor also recommended based on that phone call we just had. Okay, and then the last question.
The last question. What are two physicians' order that you may expect for this patient and why?
Yeah, so of course the doctor did recommend IV therapy getting started. The doctor might recommend a lumbar puncture and maybe any other tests that are required, like maybe even a sputum sample, so that we can see if it's meningitis or any other viral conditions that are happening with the patient. And if indeed it is a viral condition, or if it's anything that's related to an infection, then we'll probably get some antibiotics started or something that will help out the patient. And the patient has a headache as well, so maybe the doctor might, just recommend that the patient takes Tylenol or Advil or something like that, or something that helps the patient. Hopefully to help the patient with that. Yeah. So that's it. That's the assessment. Thank you very much.
Bye.